The Leapfrog Top General Hospital Award is widely acknowledged as one of the most competitive awards American hospitals can receive. The Top General Hospital designation is bestowed by the Leapfrog Group, which is a national watchdog organization of employers and other purchasers, widely acknowledged as the toughest standard setters for healthcare safety and quality. This year, highlighting its nationally recognized achievements in patient safety and quality, CHI Memorial was named a top general hospital nationally by Leapfrog. More than 2,200 hospitals were considered for the Top General Hospital Award, and CHI Memorial is one of only 32 general hospitals to receive the distinction. This outstanding achievement is possible because physicians, advanced practice providers, and every single one of our employees and volunteers at CHI Memorial puts the safety and the well-being of our patients first every day. Hard work and dedication goes into keeping safety as our #1 priority, and that is why I want to welcome some of our leaders who get to witness the amazing contributions from each and every one of our staff members. With me today is Dr. Matt Codsey, our Chief Medical Officer here at CHI Memorial, Sherry Fusco, our Senior Vice President for Surgical Services and Chief Nursing Officer, and Karen Frank, our Market Director of Quality. Thank you all for being here today. So Dr. Codsey, I'll start with you. One of the most critical components of the Leapfrog survey is the patient safety practices. And it's a deep dive review of our safety culture of all hospitals in the country. How would you describe our safety culture here at CHI Memorial?
Well, I'd say safety really is a part of everything we do every day. And that really is founded on the interaction between our provider staff, our physicians and APPs, and our nursing staff, because it involves detailed care, not only in terms of making sure the patients are getting what they need clinically, but that the care they receive and the treatment by the nurses, the approach to safety and maintaining things like IV lines, central lines, Foley catheters, making sure that they're maintained well and that we avoid any infections. So that's a key element of all of our safety.
Yeah, and culture doesn't happen overnight, does it, Dr. Codsey?
Oh, no, it doesn't. No, it doesn't. It's a lot of work.
Yeah.
A lot of work.
And it's really a foundational element, right, of this whole award. And it takes many, many years, a real legacy around quality and safety.
Safety isn't something we do, it's how we do what we do. So we incorporate safety into everything. It's foundational here. We have safety huddles every day. We talk about, with leaders and departments have safety huddles. Our line huddles, we talk about things every single day, and we stay on it every single day.
Yeah, it's that constant pursuit of excellence. Mm-hmm. Well said, Karen, well said. Sherry, hospitals around the country have seen an unprecedented staff shortage right now in the last few years. Leapfrog does take staffing adequacy into account when they make their designations and they make their grades, their rating systems. Talk to us a little bit about what our system's doing around staffing and how we're using that to help with this Patient Safety Leapfrog Award.
Well, we do have an RN residency program and critical care fellowship where we have been accredited by the American Nurses Credentialing Center. Practice transition accreditation program. We have shared governance for all of our clinical operations. We have nursing professional practice councils. We routinely and consistently share all of our assessments, our risk assessments, and our unit-specific performance across the system, from the board to our medical staff, our executive leadership team, through our nursing practice councils, and always with the focus on measurable improvement opportunities that we have. And always our focus is on all of our quality metrics. We look at CAUTI and CLABSI and HAPI and sepsis, our patient experience scores, all of those things factor into everything that we look at.
And the phenomenal teamwork that we have here is just superb. Our Clinical Operations Council, led by Natasha McGee, spotlights all the disciplines working together, and safety and quality is number one there.
Always number one. We always say that, people first, right? And it's the people that make the difference.
They are our most precious resource.
Yes, so.
And we need to take care of them and their well-being in the process.
Thank you, Sherry. Okay, Karen. So Leapfrog's never events policy asks hospitals to commit to basic acts if a never event does occur. Could you walk us through those events and how it works and our commitment to treating patients and staff with respect with regards to never events?
Right, we're a highly complex organization and we practice high reliability. So never events, we hope, is just that, never events. When an event does happen, we have a process that we go through, and that matches all the regulatory bodies and Leapfrog's expectations. So we're very transparent. We talk to the patient and the family with regard to what happened there. We waive all costs regarding to that event and any subsequent events. Taking care of the staff, that goes hand in hand with taking care of the patients and families, taking care of the staff involved in that situation. And then we conduct what's called a root cause analysis. We know that process improvement is what we're about, and so we look at the process in which something may have failed and work to improve those processes so it doesn't happen again. And we share it with our colleagues and we learn from each other.
Yeah, I think the point that you just there made was learn from each other, because we work hard to not have events, but sometimes they happen. And the best is how we recover from those and how we learn from them. So.
And we all have accountability. It's a team effort.
That's
Absolutely.
true. That's true. Back to the team and the people and the importance. Dr. Kotze, back to you. So day in and day out, you get to see how our staff works very hard to identify risk and hazards around patient care. What are some things that patients and their families can be sure of about their care here at CHI Memorial?
Well, they can be sure of several things. One, the quality is incredibly high. And it's high because of the dedication of the staff. Not only to making sure the patients are safe, that errors don't happen, that the patients are getting the treatment they need, but there's really a sense of compassion here that you don't find at other hospitals. And that compassion really sets the standard for how we take care of our patients. We take care of them as if they're family. We take care of them as if they were our own. So that focus is there all the time. And to Karen's point about not just never events, but when something does happen, if there's an infection that's unexpected or something that we feel could have been prevented, we're having conversations about those almost immediately and looking at all the possible causes, all the things we can change to make sure those things don't happen again. So the essence and the foundation of what we do here is that we truly care.
It's the secret sauce, isn't it?
Yes, ma'am.
We say human kindness is important, and we live it every day.
Yes, we do.
The foundation of our Sisters of Charity of Nazareth is our secret sauce. They
There
taught
you
us
go.
well.
Yes, very good, Karen. Okay, Karen, last question to you. Can we quickly go over just some of the survey components for the Leapfrog? So the audience has a really good understanding of the rigor of the survey and the qualifications to achieve this award.
The survey includes all kinds of things from all different departments, from imaging, surgery volumes, high-risk procedures, readmissions, barcode med administration. Every safety aspect that we have is measured, every single thing. And our publicly reported data is all in there. There's 39 measures there. So there's no hiding behind anything. So we truly do good work, and is evidenced by this award.
That's impressive, isn't it? I've told folks that what impresses me most about this Leapfrog Award is that Leapfrog sets a standard, and they don't waver from that standard. And if 0 hospitals achieve it, 0 hospitals achieve it. It's only those that achieve the standard that get acknowledged. And I think that's good, setting a high bar. So thank you for sharing that.
It's not a
Karen.
sliding scale.
It's not a sliding scale. Okay. Okay, so thank you all for your Q&A tonight. I think this is an awesome teamwork, again, a good example of teamwork, and the points you all highlighted were so important, from the legacy of culture to the staff to the learning environment. Very, very important, and all of it coming back to our legacy, the Sisters of Charity of Nazareth and our human kindness philosophy. 2022 has been a stellar year of outstanding quality and safety here at CHI Memorial, and if there is a reason to celebrate, this is it. So thank you all for going above and beyond to serve our community with passion and with excellence. It has truly been an honor to work alongside you all.